Who is getting this, by the way? Are the demographics really changing when we look at this disease?
So, first of all, I just want to mention, unfortunately, this is a very common problem. It is estimated that somewhere 52 to 53 million people in the U.S. now have osteoarthritis of the knee.
That's about a sixth of the American population?
Well, they actually say it's 20% or more of the U.S. population, and 13% of women and 10% of men over the age of 60 supposedly have symptoms of osteoarthritis. One of the things that I've noticed, and I'd like to hear from Rich, is that we are seeing younger patients. You know, we used to see the average patient would be in their 60s. Now coming into my office are both men and women in their 50s, early 50s even, and sometimes with advanced osteoarthritis. So there is a changing demographics.
Why is this?
It's interesting. I think we've had a sociological shift in this country, right? We're active for longer, we live longer, but we're also heavier. And we have more incidence of obesity and diabetes than we ever have. That metabolic syndrome, or the group of diseases that cause diabetes and obesity, also lead to cartilage metabolism issues and lead toward the accentuation of arthritis. If you put on top of that risk-seeking sports and higher levels of activity, that can also lead to it. The other issue is we're a very demanding culture. The baby boomers want to feel good now. They want treatment for their disorders of their knee. So we're intervening with knee replacement and other surgical procedures earlier than we used to. The number of knee replacements has accelerated quite rapidly.
Mm-hmm.
I think also, you highlight really two cohorts that I see in my practice. One is sort of the obese, inactive population that develops osteoarthritis, perhaps for some biologic inflammatory reason. And then there's sort of the younger weekend warrior who really is pounding away at their knees, and that's perhaps a different mode of action of how we end up getting to this final common pathway. But I think demographically we're certainly seeing that shift in the sense that the face of osteoarthritis is getting younger. So in the decade of the 1990s, the mean onset was somewhere in the early 70s, 70, 71, 72. In the decade of the 2010s, we're seeing an onset somewhere, 60% of the new diagnoses of osteoarthritis are between the age of 45 and 64. So whether it's that it's happening earlier, whether we're diagnosing it earlier, whether or not we have more tools to treat it is not clear to me, but clearly we're seeing that younger face of osteoarthritis.
You know, you think back in recorded history, the riddle of the Sphinx, right? Who walks on 4 legs in the morning and 2 legs in the afternoon, 3 legs in the evening. It's that 3 legs. It's people who need a cane, people who get joint pain. When you look at it in this context, people were getting osteoarthritis in ancient times. But I look at folks, and I have a little hobby. I see 40 and 50-year-olds limping, and I say, how many marathons have you run? Well, I'm really healthy. Yeah, but how many have you run? And it's a lot. Is it cultural? We're forcing our bodies to do something for which they're not equipped?
We have a conundrum, right? You want to stay active and fit. You're exercising for your heart. That's the muscle you're exercising for, right? Unfortunately, if you do high demand, high impact exercise, it's not very advantageous to your knee. If you look at the incidence of knee replacement now, we just crossed the Rubicon where the number of knee replacements in patients younger than 65 will outpace the number of patients over 65. Whereas it wasn't not too long ago, 25 years ago, where very rare it was to have a knee replacement in people under the age of 65. So we've changed plus the operation has improved greatly too.